Minister Butler, you sat there and I spoke from here when we were rolling over the emergency powers, and I asked what mental health data was considered. I was told it would be published. Now, since then, I have ascertained that there are essentially two bodies collecting mental health data in Ireland. There's a National Self-Harm Registry. We know that their work ceased during the first lockdown. We know that they recommenced collating and collecting data at the end of August, both prospectively and retrospectively. But equally, as of now, we know that we only have data in respect of 45% of hospitals, or 12 of the 36 emergency departments. Now, Minister, that's simply not good enough. We were told, doctors tell us, I was told actually, that the public health doctors, they consider mental health data. And don't worry that the National Self-Harm Registry isn't functioning, because there's a HSE National Clinical Programme for collecting data on patients presenting to emergency departments following self-harm. And that programme is run by the HSE and by the College of Psychiatrists. Now, I specifically asked for the information that they collected in a parliamentary question, and I got nothing back. Now, this is being presumably collected with public money. So I would ask, I'm assuming there is no data, because if there was data, I would have been provided with it. Does the HSE consider it good enough that there's a programme which is about collecting data which doesn't collect the data? The programme is jointly run with the College of Psychiatrists of Ireland. Does the College of Psychiatrists, and we're told, and I believe, that psychiatry is data-led, that it's an empirical science. Does the College of Psychiatrists think it's good enough to proceed without data? Because it's simply not. Lastly, I want to flag the lack of information regarding suicides in Ireland. And the reason we don't have centralised data, at least up-to-date data, is because it's obviously there are 37 coroners districts and there is no centralised database. Now, the Gardaí obviously have to investigate causes of death if they're not if somebody hasn't been very recently attended by a doctor. In 2000, a review carried out by the Department of Justice recommended that there be a centralised database for all coroners in Ireland. That's 20 years ago this month that report was produced. I call on you to act in respect of the three organisations that I've raised: centralised database, National Self-Harm Registry, and above all, this national clinical programme that the HSE is running with taxpayers' money, along with the College of Psychiatrists, and not providing any data to anybody.